Good morning, everybody. Good afternoon, wherever you are in this wide, crazy world. One of my oldest friends, Dr. Jeff Sklar, whom we shared many a moment together in college, and I'm happy to call a brother, entered into a wonderful, interesting relationship with a Cancer Centers of America hospital. You'll correct me on the name if I got it wrong. And he was providing quality chiropractic care to oncology patients, cancer patients. And I want to get his perspective on that after 12 years. And I think there's a lot to learn here. And I want to welcome Dr. Jeff.
Thanks. It's great to see you, Joe. Glad to have you back in Down Under.
And I love Philadelphia. I've been there 6 to 7 times, and Jeff's my man in Philly. So give us a little background on the Cancer Treatment Centers of America, yeah?
So I began working with them back in 2009, and there wasn't a lot of guidance for me. So there was a lot of trailblazing that I needed to do. I was working in a medical community that didn't know much about chiropractic or what it could offer for cancer patients. So when I started there, it was part-time. I had my own practice in the historic district of Philadelphia that you had been to and visited a couple times. So when I was starting there, I had to do a lot of chiropractic marketing, basically, to the medical staff. I had individual meetings. I was also doing a sort of a spinal health class for all the patients that were interested as well. There was no guidance in terms of when we were at Palmer. I don't remember any courses of how to treat side effects of chemotherapy, radiation, maybe a little bit of, post-surgical scar tissue, that kind of thing. But it was a slow process to really get these physicians to refer patients and say, well, let's see what this guy can do. Over the course of time, I became a member of the medical executive committee, voting on credentials, policies, that type of thing. And it just became this kind of compatriot type of relationship. So we were all on equal ground, equal setting. It was all about the patient. So basically, the model of care at cancer treatment centers was whatever it takes to improve the quality of life of this patient. So if you're going to extend somebody's life, you better take care of the quality of life each step along the way. And
did they kind of grow in appreciation of your contributions in chiropractic care?
Oh, in a big way. I mean, the referrals came to my office. So I started out there as a contractor. And after 6 months, they had these focus groups. And in the focus groups, they asked the patients, what are we doing wrong? What are we doing right? What can we do better? And there was an enormous call for them to hire me as the full-time chiropractor. So I'd only been there 8 hours a week. And after 6 months, they said, please sell your practice. And I said, give me 6 months. And then I became basically they called me the medical director of chiropractic services for the Northeast region of the country, of the US. So there was a lot of, and because of the model of care, so basically you had naturopathic doctors that were basically co-quarterbacks with the oncologist to make sure, again, that you were treating the side effects and the collateral damage that treatment can cause, that treatment frequently causes. And with that, we had acupuncture, massage, along with, chemotherapy and radiation. So everything was addressed to make sure that no stone was unturned when it came to patient safety, when it came to patient quality of life. Wow.
So in 12 years, like, you didn't say, oh, I wish I wasn't taking care of normal people or people without cancer. You grew to enjoy this approach?
So, it's the way I kind of describe it, even, through 12 years, I couldn't believe that I got to work there. I pinched myself every day. Not to say that there wasn't adversity through it. There were certainly when you're somewhere in a corporation, you're going to run against, you're going to find adversity. You're going to find people that are not your biggest fan. But, you know, through it all, for 12 years, I was thrilled that I got to go to work. Not a lot of people can say that. You know, I mean, chiropractors, we have a really great, I think, high level of satisfaction to our jobs because we're touching people, we're making people feel good. I'd say the most difficult part of it was the loss. So there was not a lot I could, you know, I did everything I could to help extend life and help extend quality of life. I didn't treat cancer. I treated patients with cancer for, you know, for all the things that ailed them that I might be able to help with.
Yeah.
But, you know, at the end of the day, it was incredibly, the staff, the patients, the caregivers, it was incredibly exciting every day that I got to go to work. But I'll still, you know, think about people that I lost 10 years ago. And so that's like the greatest impact it has been for me is the amount of loss.
Yeah. It'll be slightly more than the average practice. What differences, say, for us who work in the, you know, standard world, what do you think you came across? I mean, and the average chiropractor has patients with cancer too. Is there anything that you thought that was unique about the patient presentations, things you had to be careful with, or anything come to mind?
Well, certainly. So we had to come up, because there was no real protocol of what are the indications or contraindications for chiropractic care with cancer patients. We had to really, as a group of chiropractors in 5 different hospitals, come up with our protocols so that we could make sure the oncologists were safe. They felt safe to refer a patient to us. So just that we would have the most recent images, most recent scans, most recent blood work to know if there was any metastasis, if there was any space occupying lesion in a region where the patient was complaining of, you know, say if there's, you know, I have pain between my shoulder blades and, you know, all of us like, oh, you know, maybe you have a rib out, maybe it's just, you know, T5, I can adjust that. Well, hold on a second.
Wow.
How long's it been going on? And, you know, stuff that even a chiropractor in the field, like we all know, you're going to get most of your information from your history. I had the fortune of a great electronic health system where I could just go right when somebody came in. I knew when their last scan was. I knew how long from all the other physicians that were there. All the notes were right there. So, you know, things like space occupying lesions, as I mentioned, any type of bone mets, low platelet counts under 50, you know, we were just looking to make sure we were avoiding causing any damage to the patient. So, you know, there were those things. However, you know, if somebody's got acute hiccups from chemo and they have bone mets in the sacral wing, I can still help them with their acute hiccups, you know, cervical, because we know what to do.
Is that something? Is acute hiccups?
It is. I've gotten with acute. Chronic cases are much more challenging, but I got a lot of referrals from the infusion clinic when patients would get hiccups. And it basically is just, you know, using the just some SEM work, you know, what we learned in, I don't know whose class it was. 3, 4, 5, man. Exactly. 3, 4, 5. So, and then, you know, a little bit of abdominal, like right around the diaphragm work, and right around, you know, around something. It's pretty cool stuff. The other thing, so is it, you know, again, this stuff didn't just come to me, you know, immediately. I had to kind of see, what can I do for neuropathy, like chemo-induced neuropathy for patients. I was able to find this arnica cream, and there's a lot of arnica creams. There's, you know, the potions that when you go to a convention, it's like, oh my gosh, I'm sure it does work, or here's a new tool, or look at this thing that zaps your brain and, you know, remagnifies you so that you can be healthier. I'm like, it gets overwhelming at the conventions, but I did find an arnica cream that is really, really helpful for neuropathy. That combined with what we know about biomechanics and what we know about neurology, I was able to basically, for the feet, for instance, trace the neuropathy. So we want to really just do what we can to improve the communication peripherally to centrally.
Yes.
And it's been very, very effective. It's a few different things, and I won't go into detail with it. But it wound up really helping a lot of patients, and it kept my practice thriving because the patients would tell the oncologist, like, I don't know what he did. And I always like to think that it was a group effort. So we had the naturopath prescribing L-glutamine to protect the axons and just, the nerve transmission in the myelin sheath. And then acupuncture, and the nutritionist, some, B type of complex. But overall, it was a group effort, but definitely
what a great team. This may be a bad question. Who was your closest ally on that team, do you think? Or was it 50, equal?
During my tenure, I'd say at this point, it would be this one particular oncologist. Really, there were like 5 or 6 oncologists, but there was not one particular ally.
Right. So you would call on
each
different specialty as you needed for each different person.
Sure. There was, I'll tell you, I worked very closely with the physical therapy team, which in the States is pretty cutting edge, since there's always been kind of a little bit of adversity between chiropractic and PT in the States.
And what I found, that when PTs and chiropractors work together with their strengths, it is a great synergy.
Yeah.
Yeah,
that was probably my greatest relationship was with the rehab department. Now that I'm thinking about it, sure.
Yeah, it's an interesting thing. What worries me, Jeff, is that here you are, a groundbreaker who had to work a lot of this stuff out. Now, number one, is anyone replacing you? And number two, how are we going to keep this knowledge alive for the greater good?
Okay, so what we didn't discuss is that the hospital that I work at was recently sold to a local healthcare system, Temple University Health Systems, and the Philadelphia hospital is shutting down. So when we say, well, who's going to replace me? Joe, you're irreplaceable. I'm irreplaceable.
Right? Yeah, but I mean, chiropractic in general is going to go, is it?
So, well, the hospital's gone. So that there is a chiropractor remaining at maybe one of the other hospitals. I think that the pandemic and insurance contracts have changed the model of care for cancer treatment centers. So they've kind of lost some of their vision, and it's very sad to me.
Yeah.
But as far as the work that I started, I'm going to continue to do that work in Philadelphia. I'm looking for opportunities of lecturing around the country because, as you know, over the last 12 years, I've done a lot of lecturing around the country and overseas. And all the information I've delivered has been very well received. So there's some case reports that I have online, just different things that I was able to do for like nausea, just using everything we learned at Palmer, that some just very effective things. People say, well, what if it's placebo? My feeling is this: if I've helped somebody feel better and they were nauseous and now they're not and they can eat, then enjoy the placebo. It's been my pleasure,
Well, I have to say that the best placebo you ever gave me was the corned beef sandwich at 4th Street Deli.
Yes. Of course, it also may have led to a little cardiac issue, but who knows?
Nah.
Nah.
However, and that's what it was a revelation to me, that you had to drum up a lot of your own kind of education. You just didn't go in there and receive all these people. You had to educate, and you did tours of, like you say, and lectures and the benefits of chiropractic care.
Yeah, one of the earlier really great wins that I felt was when I was able to get the leadership of the American Chiropractic Association to come from Washington, D.C. And a couple of them came from, somebody came down, I think, from Connecticut, someone came in from Ohio, and certainly the home office in Washington. About 4 or 5 guys came up to Philadelphia, and I was able to give them a tour, and they were blown away. And it did, kind of open up opportunities. I think that the cancer patient population is over medicated and undertreated, as I'm sure you agree. When I say undertreated, meaning the kind of work that we do, or the kind of work that like-minded clinicians like us, whether you're an acupuncturist, a naturopath, or, even if you're a yoga practitioner. There's so many avenues that cancer patients aren't finding themselves on that can offer them relief. And there's, even in your practice, in so many of our practices, when we see these people, when you've been doing what we do for over 20 years, and you see a patient have an aha moment, like, all I had to do was this particular thing that you suggested, and now I'm sleeping through the night, let alone if it's, specifically like a cancer patient, and I tell them, well, if you do this, it's not going to hurt as much, or you'll be able to kind of lower your blood pressure on your own by doing some mindfulness, or whatever it is that we learn in our own lives. Not just that we learn,
Sure.
as education, but you know what, this has worked for me. I've had challenges in my life, and yet I'm getting through, and I'm getting through in a stellar way. So here's a suggestion that I can pass off to you. Now, something that you also, Joe, I know you can relate to, is I've incorporated music for cancer patients into my practice.
Wow.
And a couple of really good stories with that. Do we have time?
Yep.
Okay. So I had this one gentleman, he was getting 6 weeks of radiation. And I asked him, I said, and due to, with streaming music, I was really able to just at a request, give a patient what they wanted. And he said that he liked to chant, or he liked chanting music because he was Hindu. And so I saw him 3 times a week for about 6 weeks, and he had no side effects. And he wrote me this letter. And I actually, just after cleaning out my office, I came across this letter just thanking me. And he had he had the whole package, but he really felt that being able to listen to his chanting while I was working on him played a huge role in his energy level and his quality of life, and certainly not having the side effects, the fatigue that so many patients experience when they're getting radiation.
You're saying during the session, there was music playing? Is that what you're saying?
Yes.
Wow.
Exactly. So I was doing some flexion distraction and just some automated stuff. So it allowed me sort of, hands-free, just doing some hands-on work. Another great story. I think you'll appreciate this. I don't know if I've ever told you this, Joe. There was another guy came in, and he had he was in his 50s. He had pancreatic cancer. He came in with a cane. I got him on the table, and I said, "Can I play some music?" He says, "I really like bluegrass music." I said, I'm going to put some bluegrass on for you. And the first song that came on was Dueling Banjos. Ding, 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 ding. And as the table's flexing, going up and down, his feet, because I didn't have him strapped in, his feet start going like this to the music. And I told him to calm down. It's like, I'm enjoying it too, but you need to relax your legs. Well, when we were done with the treatment, he jumped off the table, shook my hand, went back down the hall, and he was right by the nurse's station. I had to yell out, "Billy, you forgot your cane." Yeah. That was just one of the highlights of my tenure. I'll never forget that. It was a lot of fun.
And so everybody knows, probably both you and I, our first love is music, and but we love chiropractic too. But I think if we had to give something up, it wouldn't be music. And I didn't know that you'd incorporated music. That's astounding, and that says so much for the future as well. But speaking of the future, what do you think I know you're at a difficult time, because it's like a divorce, good or bad. It is a divorce. Yeah. What do you think's on the horizon, Jeff? Do you want to go into normal practice, or do you want to continue, maybe, if you can, down this specialty line?
So I've been picking the brain of some really smart chiropractors and some other people that I know. And I just don't think a general practice is in store for me. I don't think that I could do that.
Well, you've got too much up your sleeve.
Yeah, exactly. So I'm working some different avenues right now. There's actually a nonprofit cancer wellness center that contacted me. They haven't opened yet. They're opening late fall of 2021. And I'm helping them organize their team right now. That's just sort of just with some of my time, but they would like me there's a possibility of me spending a lot of time at that practice, and it's not going to be working for free, but because it's a nonprofit, it'll be reduced. But the amount of job satisfaction will fill me up. But there's other things that I'm thinking of, just some hybrid things, and again, some lecturing, some writing. Maybe I'll be interviewing you on my own YouTube channel. You never know.
I got nothing to say.
That is not a true statement.
Well, man, it's been great. I want to be in Philadelphia as soon as this crazy, stupid world settles down again. And I think that, and when you think about it, this channel that I've started is partly due to the quarantine. I am in quarantine, and it's bringing us together, and we just have to keep looking at that silver lining. And chiropractic is a silver lining, and glad to see that you're still carrying the torch, my friend.
Thank you, and thank you for all the work that you do. And you and I, we are brothers, and we've had some things to persevere and overcome. And man, there's always light around you, Joe. There's always light, and so that's why I continue to hang out with you, because you bring a lot of light to my life, and I'm very grateful for that.
And I can tell you that the people on this channel, brothers and sisters, that's what it's all about. Well, I'll catch you soon, Dr. Jeffrey Sklar.
Thank you. Appreciate it.